One of the reasons I believe stem cell therapy for neurological diseases should be done by a specialist who majored in the nervous system isn't because of a difference in the stem cell procedure itself. It's about the diseases that stem cell therapy treats, why they occur, how they progress, whether they improve or worsen. For these aspects of the disease's progression, neurological diseases are not quite that simple. It's about being able to fully understand and manage the course of the disease, including diagnosis and its prognosis. In that sense, I believe it's more appropriate for a doctor who specializes in neurological diseases to perform the treatment. The main symptoms and diseases I treat, well, since I'm a neurosurgeon, I focus on neurological diseases, cerebrovascular diseases, autoimmune diseases, or conditions like chronic fatigue, improving liver function, and reducing inflammation that occurs throughout the body. I've been applying it to these kinds of symptoms. This is a personal story, but I've been interested in stem cells for a relatively long time. So before becoming a neurosurgeon, I spent about a year in a developmental biology lab studying and researching stem cells. The reason I decided to study and research stem cells was because I knew that there were so many neurological diseases that couldn't be treated or cured. And I wondered if there were any new treatment methods or alternatives that hadn't been tried. Of course, I wasn't a neurosurgeon then, but from the perspective of a general student, a general practitioner, I had these thoughts. And I came to believe that for treating intractable neurological diseases, cell therapies like stem cells or immune cells could be an alternative. Based on this personal conviction from my younger days, I spent about a year in the lab conducting research and studying. At that time, the whole country was abuzz with news about Dr. Huang Woo-suk. For about a year, while working as a teaching assistant in a developmental biology lab, I conducted various stem cell-related experiments and research on lab mice. I was particularly interested in research where we would artificially induce a stroke in a mouse's brain and then inject stem cells. Although the difference wasn't dramatic, seeing occasional cases with therapeutic effects, at the time I wasn't a neurosurgeon, so I wondered, why can't we perform these treatments on human patients, not just mice? What's the difference between a human brain and a mouse brain? And after a stroke, when hospital treatment is over and the after effects are severe, if we use stem cells for treatment, wouldn't that help improve the sequelae? I really thought about this a lot. As a result, the research and experience in the lab were fascinating and interesting, but I felt something was lacking, and that feeling wasn't resolved. So I thought that if I gained more clinical experience and then returned to stem cell research, it would be more helpful for applying it to actual patient treatment. At a university hospital, the departments that specialize in neurological diseases are, broadly speaking, about three: neurology, rehabilitation medicine, and neurosurgery. These three departments all deal with neurological diseases, but their approaches are slightly different. Neurology identifies the cause of neurological symptoms through various tests and analyses and primarily uses drug therapy. It tends to focus on making an accurate or differential diagnosis. And rehabilitation medicine focuses on rehabilitation after surgery or treatment for neurological diseases. On the other hand, neurosurgery, like neurology or rehabilitation medicine, deals with neurological symptoms and diseases. However, its main area of treatment is surgery for conditions not suitable for drug therapy, such as cerebrovascular diseases, brain tumors, Parkinson's disease, or spinal diseases. To put it simply, you could say that neurology diagnoses various neurological diseases, neurosurgery performs procedures or surgeries, and rehabilitation medicine provides rehabilitation for after effects or functional decline. The specialty I chose after finishing a year of research in the lab and completing my internship was, in fact, neurosurgery. I had always been very interested in the nervous system, and during my neurosurgery internship, I had the chance to participate in the neurosurgery operating room. At that time, I saw actual surgeries on patients with cerebral hemorrhage, cerebral infarction, or brain tumors. Seeing the brain with my own eyes, which I'd only seen in books or videos, it felt like the brain was moving and breathing, and the sight of the cerebral blood vessels pulsating was also very exciting. So that moment prompted me to apply for neurosurgery. Looking back, I do feel a bit of regret, thinking it might have been an immature decision. But at the same time, I also think that perhaps it was destiny. And these days, it's common for neurosurgeons to pursue a subspecialty even after becoming a specialist. Broadly, it's divided into the brain and the spine. For my subspecialty, I chose the pituitary gland and, among brain tumors, skull-based tumors, which are the deepest and which everyone tends to avoid. I then worked as a clinical research assistant professor for about 2 years. When I recall that time, I think my average arrival time at work was around 5 or 6 in the morning, and my average time to go home was around midnight. I think I was living a life that's unimaginable now. Getting back to the main point, about 7 years ago, a visit to the Kyushu University Stem Cell Clinic in Japan led me to think that I should try applying this stem cell therapy in actual clinical practice. So, along with treating the autonomic nervous system, I've been performing stem cell procedures for several years. I provide a thorough explanation to patients with various neurological and vascular diseases. Then, within the legal scope of the current law, I collect bone marrow or fat, separate and concentrate the stem cells, and perform the procedure. For the first few years, most of the patients were acquaintances, relatives, or people they referred. But in recent years, it seems that general patients have also shown more interest than I expected and are undergoing stem cell procedures. The main symptoms and diseases I treat are naturally related to my specialty as a neurosurgeon, so things like neurological diseases, cerebrovascular diseases, and autoimmune disorders. I also apply it to conditions like chronic fatigue to improve liver function or to reduce inflammation throughout the body. One of the reasons I believe a specialist in the nervous system should handle this is because administering stem cells through the carotid artery or cerebral blood vessels is really the domain of a neurosurgeon. It's not an easy approach for doctors in other specialties. Now, aside from the specific route of administration, there might not be a huge difference whether a neurologist, a neurosurgeon, or another specialist performs the procedure. The key distinction isn't in the procedure itself, but in the deep understanding of the disease being treated. For these conditions, you need to know why it developed, its typical course, what leads to improvement or deterioration. The progression of neurological diseases is not simple at all. A specialist can fully understand and manage the disease's course and prognosis, including the initial diagnosis. In that sense, I believe it's more appropriate for a doctor specializing in neurological diseases to be the one performing the treatment. As a result, I've had the opportunity to perform stem cell procedures on patients with various neurological and cerebrovascular diseases, though the numbers aren't huge. In Korea, it's actually quite rare for a private clinic to offer stem cell therapy for neurological diseases. Of course, there might be some I'm not aware of, but this has given me the chance to gain a wide range of experience with stem cell procedures much earlier than most general physicians. However, I do feel there's a significant limitation. My biggest regret is that if we could culture the stem cells to increase their numbers before administration, the therapeutic benefits would be far greater. Starting next year, if the amendment to the Advanced Regenerative Bioact is implemented, cell culturing will become possible in certain authorized hospitals, not all, but a select few. Therefore, we are also preparing to obtain that authorization, hire our own researchers, and collaborate with domestic stem cell culture companies. We aim to provide more systematic and indeed more aggressive treatments than we can now. So, in the next few follow-up videos, I'll be focusing on stem cells, which are a hot topic in advanced regenerative medicine and are expected to be commercialized soon. I'll be covering new information that wasn't discussed in the previous stem cell related videos on our channel.